almost time. Our program will begin soon. Please take your seats. As a courtesy to others, please silence your electronic devices, and don't forget to use the Summit hashtag #CFASummit. It's almost time. Our program will begin soon. Please take your seats.
I have a selection of microphones. Okay, thank you and welcome back from the break. Yesterday, we heard about the amazing and transformative work that's been being done in integrated benefits, reimagining how the social safety net might work. We heard some great stuff from Laura, Stacey, Terry, Nina, and Patrick. And you know it's a good idea when there's others doing work in the same area. So to kick off our first track keynote for digital delivery today on shaping a bold future through delivery-driven policymaking and universal family care, please welcome Sarita Gupta, Co-Director of Caring Across Generations.
Good morning. My name is Sarita Gupta, and I'm the co-director of Caring Across Generations. Thank you to the organizers of the summit for inviting me to speak this morning. I'm really thrilled to be here to talk about a new policy concept called Universal Family Care, and the work that we've done in partnership with IDEO to advance a delivery-driven approach to this policy design. And I just want to acknowledge Kate and Amanda and the team at IDEO who are here, who've been amazing partners in this process. I want to share a little bit about myself to begin with. I am a working family caregiver in the sandwich generation. I just said a lot, so let me unpack that a little bit. So I work full-time, but I am also a family caregiver to my father who has Alzheimer's and my mother who has declining mobility issues. They have been living with me for the past 3 years, and then most recently, a few months ago, moved into an independent living community in Maryland where I live. At the same time that I'm now caring for my parents, I also have a young daughter to help care for and raise, hence the sandwich generation label, or I like to call it the panini generation. And actually, my husband and I really do honestly feel squeezed as we try to manage the care needs on both ends of the spectrum. Navigating my family's care needs and wishes have been really difficult. Learning about Alzheimer's disease has been overwhelming. Everything from researching adult day services to support groups for my mom, to managing the costs of care, to finding direct care workers, and just ensuring that my parents have all that they need to be able to live independently for as long as they can. And here's the thing. I am not unique in this or special. Millions of families are headed down this path. My own life experiences have deepened my commitment to this work and the work of Caring Across Generations, which is a national movement of families, caregivers, people with disabilities, and aging Americans working to transform the way we care in this country so that all families have options to ensure that their loved ones can age with dignity. We've been organizing in communities around the country to transform our caregiving systems and policies that create access to affordable care options for aging adults and people with disabilities, that ensure that there are more supports to family caregivers, those who are in the labor force and those who have left the labor force, and to improve the existing direct care jobs and really grow this workforce. We know that caring for our loved ones can create some of the most special and joyful moments of life. Yet the current care paradigm overshadows these moments as families struggle to both work and provide care. Our care needs are exploding in our nation. We are in the midst of an unprecedented elder boom. Every 8 seconds, another baby boomer turns 65. That's 4 million per year. And they're living longer than ever, about 20 years longer than when our safety net was put into place. And their stagnant incomes and diminished savings are no match for the longer lifespans, the reality of rising costs of treating chronic medical conditions and addressing long-term care needs. We know that by 2040, nearly 30 million Americans will need some form of home care to meet their basic daily needs. And we know that most seniors prefer to age in their homes and in their communities. On top of that, millennials are having children at a rate of 4 million babies being born per year. And we know there's an incredible need for childcare supports. Our system for supporting caregiving as a whole, from childcare to elder care, is broken. Almost 2 decades into the new millennium, we still have a system of caregiving that was built during a time when the economy functioned on the presumption of women's unpaid care in the home. This is no longer our reality. More women are in the workforce. The burden of care is falling heavily on family members, and in particular on people like me in the sandwich generation, caught between the demands of both childcare and elder care. The cost of care is outrageous for seniors and people with disabilities and for most families. So let's do the math a little bit. 70% of our workforce in America earns less than $50,000 per year. And the average cost of childcare is over $10,000 per year. The average cost of a private room in a nursing home is between $80,000 to $100,000 per year. And like my family, about half the workforce expects to be providing care for elders in the next 5 years. And not just a little bit of care, by the way, but a pretty substantial amount. Of the 42.5 million unpaid family caregivers in the US, more than half provide an average of 20 hours of family care per week while working full-time. Yet, we don't have the supports in place in workplaces like paid family medical leave or ensuring that elder care is included in leave plans to help people meet their caregiving responsibilities without risking loss of their jobs. The numbers just don't add up. We can't afford the cost of care. We need a bold solution to address the real pain points families are facing or will be facing in the coming years. So we began to imagine what a policy vehicle could look like that is portable and universally accessible, that helps families afford childcare, elder care, and paid family leave, and everything you need to work and care for your families too. That's the concept of universal family care. One social insurance program that everyone contributes to, that everyone benefits from, that helps people afford care across the lifespan and allows for an infusion of money into our care systems to support professionalizing and stabilizing the care workforce. We are in a moment of big ideas. And we believe universal family care is a big idea that speaks to one of the key needs of people today: care and caregiving supports. Our plan over the next few years is to build a powerful, dynamic movement to support family care and the idea of universal family care in America through culture and narrative change, like really creating a 360-degree storytelling environment about the urgent need to invest in our care infrastructure in this country, and long-term to transform how we value care and caregiving in our nation. We want to win state-level family care and long-term policy change that models aspects of the federal policy change we seek. A few years ago, we won the Kapuna Caregiver Program in Hawaii that's a financial benefit for working family caregivers. And just a few months ago, we won the first publicly financed long-term care benefit for Washingtonians in Washington state. We want to continue to work with partners and policymakers to advance the needs and opportunities and vision for universal family care at the federal level and begin to offer actual building blocks of legislation towards this vision. And finally, we want to work to bring elder care and universal family care into a crowded national political discourse in 2020. One of the things we grapple with is how to make universal family care feel doable and real. So with IDEO, we set out to answer, how might we translate our policy vision into a tangible user experience? We work a lot in the space on the right in this image here, where the policies, regulations, guidelines live, and where we know it's where the government actually articulates its intentions, right? But we know that what people experience isn't the policies, it's the services that these policies translate through government programs into. Each of our relationship with our government is through our services. Think about the DMV or the post office or public schools. It's been the interactions with those services and programs that form how we even feel or think about the policies behind them. In this way, the delivery of our education policy is actually our experience at school. The delivery of our policies about road safety is what happens at the DMV. So we wanted to answer, what would it look like for all of us to interact with the policy vision that we've laid out for universal family care that brings together early childhood, elder care, and paid leave? How might it really work in practice for each and every one of us throughout our lives? And how might we actually unify a base around universal family care? So we headed into the field to understand families' daily lives, their needs, hopes, challenges, behaviors, and workarounds. We wanted to get inspired by people to be able to design for real life rather than abstractions. We focused on the sandwich generation as an extreme circumstance in that these people, like me, are caring for both young children and aging parents. And our team joined IDEO's design researchers and team, shadowing along to listen in on the interviews in people's homes. Here's where we started, with a vision for a way of combining a set of 3 existing programs into one bucket that provides targeted support across one's life, from child rearing to helping aging parents to aging ourselves. This is an image of one of the white papers we've authored that captures that policy vision. This is the policy agenda that was recently on the ballot in the state of Maine. It's a highly detailed, well-researched document that lays out how we believe universal family care could be legislated. The first thing we did, together with IDEO, was to map out, to visualize the intent of that white paper, to look at the stakeholders, assumptions, guidelines, and programming implications, what it promised in terms of delivery of service. We met with a diverse set of families. They came from a range of backgrounds, income levels, languages, and family types. Here are a few of the families that we visited with. Teresa with her granddaughter and her mother. Esmeralda with her daughter and mother. Sally with her mom. And Leah with her son and her parents. We also spoke with care workers. What you see in this picture is a roundtable discussion. At the back in the middle, you see one of the architects of our policy vision, Ben, who was completely inspired by the home interviews he was a part of. It was actually fascinating to be part of really understanding people's perceptions and challenges and to get inspired by their hopes for a program like Universal Family Care. We often use exercises to draw out stories about division of labor, routines, hopes, wish lists. This one shows an exercise about an ideal support system. Here's a bit of what we heard from each of them. Let's go to the video.
My mom has dementia. Sometimes I don't know if she even knows I'm here or doesn't remember that I came to visit, but it makes me feel better knowing that I care about her and I love her. And she did so much for me growing up, and it's like, now it's just the other way. So, you grow up and your mom takes care of you, and now she's taking care of your mom. So with the care my mom needs, I don't know how I could work full time. And I find it frustrating because I feel like I'm not contributing much to the family income. My mom's had full-time care for the last 10 years, and luckily my dad set aside money that we've been able to go this far, but the money is running low, and I'm concerned about the next steps that we need to take.
So my family doesn't see my taking care of my daughter and my mom as a job, and it sucks because it's an all-day, everyday job. Because of her epilepsy, she's developed her mental health issues. She's schizophrenic. She takes medicine for that. It's not good to leave her by herself. She could hurt herself. So somebody always has to be home now. Taking care of both of them here at home makes me feel sometimes suffocated. If I had some money coming in to take care of my mom, I would hire somebody to come and take care of her here at home. And that way I could go back to school.
Along with my own family, I'm also providing care for my father, who was diagnosed with pneumonia back in July and suddenly put on life support. It's probably like the darkest time I've ever experienced in my life. Caretaking for my father's impacted the way I've been spending time with my son. I've been spending less time with him and really kind of missing out on those moments that I would love to catch.
I decided to take custody of my granddaughter. Her mother basically abandoned her, and CPS showed up at my door and told me that I could either file for guardianship or that they could take the child and put her in foster care. Taking care of another young child at 45 was not in my plans. So I'm in a situation where I have to rely on my mother to pick her up from daycare every day. I hate it. It's very difficult dealing with my mother. We've always had conflict. I've taken off quite a bit of work. When my mother's ill and not unable to watch my granddaughter, I'm strapped financially. I'm one person running the whole household just with my income. It makes me feel like trapped in my current position.
So the stories we heard in the field inspired our work and informed both our policy vision and the user experience. Our goal for our work together with IDEO was to bring tangibility and immediacy to universal family care, deliver a visceral sense of how it might feel to interact with a program designed to support families' needs. The mobile prototype we created together illustrates what the delivery of a universal family care program might feel like. This means how you might interact with a benefit program such as universal family care in the future. So just take a look. Let's go back to Leah. I'll tell you a story about how universal family care might help shape how Leah cares for her father in the future. Leah is ready to explore what benefits universal family care might be able to offer to her dad. And she clicks through a welcoming diagnostic, a set of questions that help universal family care identify her needs and tailor its services and supports to Leah's family situation. She quickly notices a benefits guide on the homepage. In this moment, UFC is basically breaking down the mental model of existing programs, which expects our users to know which things they're eligible for. Instead, we'll ask about their situation and needs first, then use the intelligent system to know exactly which benefits might be useful to the person. We'll hold the real application moment till later. This moment is about engaging with UFC in a low-stakes way in order to learn about what Leah may be eligible for. Leah is presented with a series of simple, straightforward questions. We heard from many of our participants that navigating and understanding government programs can be daunting. So instead of filling this exploratory moment with jargon and detail, it uses clear human language and is simple to understand and fill out. UFC asks Leah who she needs help caring for, because this information helps us refocus the rest of the experience on that specific individual and their needs. And ask few questions about her father's needs and the intensity of those needs. Who helps care for Harold? If Leah was moving through this benefits guide with her son in mind, her answers could be quite different, meaning the questions she's prompted with could also be quite different. After this diagnostic, UFC offers up ways it can help. This is so different from the way we interact with benefit programs today, with reassurance and with, as you'll see, an intelligent set of benefits grounded in individual needs. This is what it could feel like for a system to start with people's needs. Here's what you might see once UFC identified the available services that match your needs. So let's just fast forward time and take a look at what it would look like for Leah to manage benefits for her father in the future. Within Harold's suite of possible benefits, we've included things like a marketplace support, in this case, transportation assistance for getting around. By combining the benefit program into a needs-driven suite of solutions, UFC opens the ability to offer smaller services or goods as benefits for individuals who don't need large-scale subsidies or care. This has exciting preventative care implications. That need came directly from our user interviews when we heard that people basically want just enough support to stay in their homes and maintain their independence. Next, another thing that sort of came up from our research and deeply informed our policy benefits was benefits for caregivers, who we know and certainly heard in the field are overstretched and absolutely overwhelmed. So Leah sees a separate section dedicated benefits that addresses her own needs, as well as care navigators to help her figure out how to support her father. Including this moment is an enormous statement for universal family care. It starts a conversation about caring for caregivers themselves. Imagine a world in which mental health of caregivers is considered too. What an idea. What's next? After the shift from the diagnostic and the options that could support Leah, she can start the application process for universal family care. This is so different from the way benefits are currently delivered. It's human-centered and needs-based. Leah fills in a few form fields to complete her registration. So far, this feels just like any other profile registration. We've designed a registration as a simple, low-barrier screen. We've purposely left out questions that require proof of identity and complex documentation. All of those logistics would be required later, when the user has explored the benefits UFC has to offer them and is ready to prove their eligibility. Leah clicks complete and receives a welcome message. She's now a card-carrying member of Universal Family Care. Over the course of Leah's lifetime, there will be multiple moments when she might need universal family care. A simple dashboard enables her to manage multiple family members' supports and see the current status of her father's benefits. Over time, the system understands that benefits might need maintenance and can track use of benefits comprehensively. We took these prototypes back out to the same families who we interviewed at the beginning to get their feedback. The tangibility of the prototype made universal family care feel real, valuable, and meaningful. We're excited to be continuing to use this prototype to build support among our stakeholders, from policymakers to partners to the public. It helps us explain what universal family care is, how simple and real this policy could be if we can work together on it, and it helps us get on the same page so we can push the policies that will form the foundation forward. A tangible user experience has really helped us get on the same page with partners and allies, to engage policymakers about stories, needs, and opportunities, to get beyond the data and numbers, to build public support at the state level to advance models of care, to develop federal policy options, and to sharpen our overall narrative. Our policy has evolved in creating this prototype with IDEO, and we've seen firsthand how much policy can benefit from the user research and user testing. What else are we learning? Here are a few things you can take away. Having a prototype ensures we're talking about the same thing. It's a unifying mechanism. We're all on the same page when we're looking at this mobile application, and it creates belief. It simplifies, it cuts through the naysaying, and for the moment helps people envision what a completely different future could look like and feel like. In this case, how our interactions with a government service could be responsive, intelligent, and supportive. User experience is a powerful way to advance policy agenda, build support across multiple stakeholders, public partners, and policymakers. Policy is a powerful lever to change people's lives, but it's often not informed by people's lives. Our work needs to be informed by both of these perspectives, theory and the lived experience, to have impact. It can't be all abstraction of data sets, and we're not designing for endlessly variable circumstances, but understanding the whys behind user behaviors can make policy more pragmatic, to take into consideration the contradictions of lived experience and make it more human. And a policy is a set of regulations, but what matters is the service people experience, the services and programs people interact with to secure support or benefits. Whether a policy is effective or not, that happens in the delivery of the service and support to people. This outcome, the provision of service, is what matters most, and ensuring that in our policies we're taking that deeply into consideration and designing for effective delivery is hugely important. You can explore this more on your own. This is the URL. I just want to share, in closing, a few things we learned along the way. The worlds of policy and design require translation on both sides. Close collaboration, in-person and remote, is the secret sauce. And policy informs design, and design informs policy. So I'd be happy to talk more about all that we've learned on this journey with all of you. If you want to hear more, I want to welcome you to come to our workshop this afternoon, and we'd be happy to have more of a conversation there. Thank you.
Thank you, Sarita. So we're going to keep the design theme going and turn next to a very similar model. Design for America was founded to bring together volunteers to use their design thinking lens to solve some of society's hardest problems. Sound familiar? So please join me in welcoming to the stage the founder of Design for America and also a professor at Northwestern University, Liz Gerber. Design for America, I should also mention, was awarded the prestigious Cooper Hewitt Design Award from the Smithsonian this year. So congratulations to Liz. Please join me in welcoming her to the stage.
Hello, how are you? Good, okay. There's some audience participation, just to warn you. Thank you so much for inviting me today. It's a real honor to be here. I've been impressed with Code for America for many years and really impressed with the tremendous work that everybody has done to put this on. I'm particularly interested in Code for America because of the innovative nature of the organization and really rethinking about how we can help create new organizations to help government serve those who need it most. And thank you to you all who are here on a sunny day, the first sunny day I hear that Oakland has had in a while, to reflect on how we can make positive impact in our organizations, including our government, schools, hospitals, neighborhoods, and beyond. So I want to start this time with a question that I've been asking myself for some time. And the question is this: why, when we often have good intentions, do we fail to make the impact we were hoping to make? My belief is that it has something to do with the way that we are identifying and tackling social challenges. And so today, I want to tell you about the problem-solving approach that starts with a simple question: why? Not what, where, how, but why. And you'll hear iterations or echoes of what you've heard in the previous talk. So why, we might ask, why is this challenge important to society's well-being? Why is this challenge happening now? And I'm going to argue that by not asking why, we risk addressing the wrong challenges and being blindsided by assumptions, giving up when the going gets tough, offering solutions that don't help, and missing new opportunities for impact. So by asking why, we can radically expand our approach to identifying and tackling important social challenges in our communities and more reliably make long-term sustainable impact. So to convince you of this argument, I'm going to describe the organization Design for America that we started in 2008 to illustrate, to which Corey was referring. So for those of you who don't know, Design for America started over a decade ago. As Corey mentioned, I'm a professor, and I was sitting with 3 students on my floor in my office at Northwestern University in Chicago, and we were wondering at that time, could we create a networked organization that would allow both undergrads and graduate students throughout the US to work together with community partners to tackle complex problems using the human-centered design approach that you heard previously? From a personal standpoint, I had been very strongly influenced by my youth. I grew up as a young girl in Burlington, Vermont. Bernie Sanders was the mayor. Perhaps you're familiar with the name. As the mayor, Bernie was best known for his effort to lead a downtown and lakefront revitalization process. What this meant is instead of turning over the land to people who wanted to build wealthy condos for the wealthy, instead he really focused on building affordable housing and accessible parks and public spaces. So in short, he was trying to put people's needs at the center of the city of Burlington. I was also inspired by the Peace Corps, who had mobilized youth to support economic and social development abroad starting in the 1960s. And then, of course, Teach for America, which I think we all have been inspired by, that encouraged a new generation of teachers. So our vision for Design for America was to have every college campus host a design studio to use design to mobilize youth in their communities. At the time, we wanted to create this network because we believed a few things. One, young adults were being ignored as problem solvers. For too long, they had been treated as passive actors, not active creators. But we saw clearly through the 2008 Obama campaign, we saw that as an inflection point. Young adults clearly wanted an active role. So that was reason number 1. 2, we thought to improve the long-term health of society, we needed a healthy pipeline of young adults who identified as change leaders, regardless of their expertise, whether they were in law, medicine, technology, environment, anything else. We wanted future leaders to be better prepared and better equipped to work together to tackle complex challenges in a way that prioritized well-being of society over individual material gain. And third, has been talked about at this conference quite a bit, the complexity of the challenges we are now facing is too great to be solved by any one individual entity. To tackle income inequality, childhood obesity, and global warming, and many more problems, we need a network of partners between private and public sectors. And this extensive network that we thought to build, could help scale nationally challenges that we're addressing on a hyper-local level. So today, I'm proud to say we're making progress towards this vision. We now have 39 university-based studios and 1,200 passionate students actively working right now on 120 projects across domains, including environment, education, healthcare, and the economy. And the students' work is supported through our now extensive mentor and alumni network. We've graduated thousands of alum who stay actively involved and support the undergrad and graduate community. And we host virtual and personal meetups, much like Code for America, throughout the country every month, as well as convenings like this one. So where do these students go after school? Well, after graduating, these students often may start a nonprofit or a for-profit organization to pursue the projects that they started in school. And as they grow, it's been really exciting for me to see them then hire new alum from Design for America to help their growing organizations. And then there's others who go to work for industry or government, and they introduce human-centered design to their managers and to their colleagues. And then a curious effect I didn't anticipate was that many of the students who come to the United States to train as undergrads and graduate students then return to their native countries and are spreading the model there. So we currently have students working in Taiwan, graduates working in Taiwan, Pakistan, and China to spread the Design for America model for change, obviously with a different name, but the same idea. So as Corey mentioned, we were recently awarded this Smithsonian Institutional Achievement Award for using this network model to raise awareness and spread design across the country and abroad. So I know you've just heard about the human-centered design process from the previous speaker. I'll briefly touch on it, how we think about it in Design for America. We start the students by helping them identify challenge areas that are personally motivating to them. This is incredibly important. I can't say how important it is for the students to be personally motivated. We then asked them to ask what's the intersection of their personal motivation with what is important to society. Because to solve a problem that's just important to you but not for society doesn't meet the needs of our organization. And then thirdly, and very importantly, we asked that they tackle challenges that are accessible to them, which means that they can connect with stakeholders directly. So consider Matt, one of our Design for America students a couple years ago. He chose to work with a local retirement home in the city of Chicago because he wanted to reduce nighttime falls for older adults. Why? Because the month before, his grandmother had fallen during the night and had suffered an injury that then put her in the hospital for much longer than the whole family had wished. On the other hand, we have students like Yuri, who personally experienced an incident. He was in a local hospital recovering from a collapsed lung, and became very interested in this notion of hospital-acquired infections. For anybody who doesn't know of this idea, I find it interesting. You go to the hospital to get well, but unfortunately you gather an additional infection while there, extending your hospital stay. So as you can see, Matt and Yuri were looking at problems that were personally motivating to them, important to society, and accessible. So the Design for America process then guides the students to the root cause of the challenge by working with people who are directly experiencing the challenge. So in the case of Matt, it was working with the local retirement home to reduce nighttime falls among older adults. While there, he and his team worked with a diverse team of older adults, caregivers, medical physicians, family members, house cleaners, room cleaners, facilities, and many more. There were many people who had insights into this opportunity. So rather than working exclusively on secondhand sources at Design for America, we emphasize conducting primary research in the field with multiple stakeholders who might be impacted by the challenge. We asked the teams be able to get to the community partner, and to make it really concrete and specific for the college students and the graduate students, we say, can you get there within a 15-minute bus, bike, or train ride? And this is incredibly important because too often I observe that we are trying to tackle problems that we don't understand, and we're not sufficiently close to the people challenging them or experiencing them. So after this initial research, teams often rescope their challenge to focus on the root cause. So let's consider the case of Sophia, who was working to improve literacy among elementary school children. It turned out that for her, one of the root causes was actually the lack of affordable glassware for many of these children. After iterating and generating many ideas with the community and in the community, Sophia and her team actively worked to sustainably implement solutions. So by working in close proximity with partners, she and her team could more easily see their impact, or often the lack of impact, of their ideas. So Design for America was explicitly created upon the belief that it's not enough to create a PowerPoint deck and send it over and assume the ideas will be implemented, but actually to see what works and what more often does not work, and continue to work on the problem until something does work. So just to set context again, I want to remind you of the age of these people. The amazing thing is these are all 18 to 25-year-olds. They're doing this work voluntarily. They're doing it on top of their schoolwork. They don't receive formal credit from the university to do this. And I often have my faculty colleagues and parents coming to me saying they've never seen their students work harder. And I have to explain to them that what we are doing, this is a commentary on what we are doing in higher education, is that we're not often supporting mission-driven learning. So how are the teams set up? Also an interesting reflection of higher education. In Design for America, we have the teams be interdisciplinary teams. And we know the interdisciplinary teams are absolutely critical for solving the complex problems we face today. So for example, you might find a music major, an engineer, a psychologist, and a biologist working to improve the quality of drinking water outside Detroit. You might find a business, physics, English, and government major working to reduce food insecurity in New York, or perhaps a computer science, geography, and art major working to increase accessible transportation in Seattle. So while it's possible for some of these students to learn about human-centered design in higher education, many miss out because human-centered design historically has been offered to STEM students. And the teams on which they work, as I alluded to earlier, are often far from interdisciplinary. Further, what happens in classes is many students are working on what we call toy problems with known answers, rather than real-world problems. And the reason for this is because we are inevitably constrained by the semester system. We have 16 weeks to get through a curriculum. And quite honestly, the fault is also faculty. It's easier to teach and assign problems to which we know the answers. So as one Design for America student once told me, appropriately, he said, you know, we're used to teachers handing us problems on a platter. That's what we're used to. And so I always question myself, how in the world do we expect these people to be ready to address the complexity of real-world problems if we're handing them problems on a platter in higher education? And research has told us over and over again that teaching skill divorced from application can often drive students away. So that's some background in Design for America. I'm now going to return to my initial argument, which is this. By not asking why, we risk solving the wrong problem, being blindsided by our assumptions, giving up when the going gets tough, offering solutions that don't help, and missing new opportunities for impact. By asking why early and often, we can expand our approach to identify and tackling social challenges in our communities to more reliably make impact. So here's the good news, is that as we know, anybody certainly who has children in this room knows that many of us start young by asking why. I'm a mother of 2 young children, and here are just a range of questions I was asked in a single day by my son last week. Why, Mom, do we only have dessert 2 days a week, not 7? Why do some kids get free lunch at school? And why does the crosswalk sign feature a white man and not an African American man? As young children, we regularly ask why. A bit more good news. As far as I can tell, my research suggests that why exists in every language. So excuse me for anybody who speaks these languages. But in Spanish, we say por qué. In Chinese, wei shema. Hindu, kun kar. German, warkum. You get the idea. There's a word in every language for why. So given the universality of asking why, let's explore what happens when we ask why. The first is when we start by asking why, we get at the root cause of a challenge, and we avoid tackling the wrong challenge. So for example, when the Design for America team wanted to reduce hospital-acquired infections, they asked why these infections occur. They learned about the importance of doctors and nurses washing their hands, not just in between patients, but also while working with a single patient. When they asked why were doctors and nurses not washing hands with the necessary frequency, they learned that it wasn't that doctors and nurses did not care about the patient's health. In fact, it was the very opposite. They cared so much that they got distracted by focusing on the relationship with the patient and forgot about washing their hands. So the challenge that these 4 students, Mert, Hannah, Yuri, and Casey, were trying to tackle was how to remind doctors and nurses to wash their hands at key points in interactions with patients. So through this example, I hope to show you that we can't not effectively take on challenges that we don't understand. We must start by asking why. Why is this a challenge? So the exercise we use that perhaps some of you are familiar with, and I simply adore, is an exercise we call 5 whys. It's an iterative interrogation technique used to explore the cause and effect relationships underlying a challenge. So the primary goal of the technique is to determine the root cause by repeating the question why at least 5 times. Each answer forms the basis of the next question. So let me provide you with a simple demonstration. Why was I late for work the other day? Well, I missed the bus. Why did I miss the bus? I overslept. Why did I oversleep? I stayed up working too late. Why am I staying up working so late? I'm not asking for enough help at work. The root cause of me missing the bus last week is me not asking for enough help. So now this is the interactive portion, I warn you. I want you to try this with somebody sitting next to you. It may mean some of you have to move a little closer. Or you can ask yourself these questions. Why did you come to this talk? So take a moment to look at your partner, the person next to you, or reflect to yourself and ask yourself 5 whys. I'll give you 2 minutes to do this and then we'll come back. Go ahead, ask yourself why. Why did you come to this talk? You can ask yourself. It's a great opportunity to meet people. Move a little closer. Nice. How did that go? Did you learn something new? By a show of hands, did anybody come for the desire to learn something new? Okay. Anybody come with the desire for social justice, to have social justice in the world? Okay, a few more. A desire just to meet new people, have social contact. Great. I have found through doing this exercise over the last 20 years that if you ask enough times, you inevitably come to one of the 15 or so fundamental human desires and values as identified by psychologists. So I imagine in this room, many of the motivating causes are around curiosity, citizenship, social contact, independence, and so on. And so as a technologist, I'm always so intrigued by this activity because as formerly trained as a technologist, I often lead with technology as the solution. The solution is technology. And asking why always reminds me that I really need to lead with a challenge and not with a solution. I give you a little background at the toughness that this has been for me to learn. Since I was a little girl living in Burlington, Vermont, with Bernie Sanders as the mayor, I've loved to build. In my childhood bedroom, adorned with rose wallpaper, I built an extensive Rube Goldberg machine running from my ceiling light switch to my bedside table so I could turn off my ceiling lights without leaving my bed. I was very proud. Thank you. Somebody laughed in the beginning. Somebody else has done this. Thank you. If I had asked perhaps why I needed to turn off my lights by my bedside, I would have learned that it was really the reason I built that gadgetry was really about my desire to learn how to build a Rube Goldberg machine rather than the actual necessity of building that thing. I'm sure my mother would have appreciated it had I not built that. And then when I was 8, continuing my building streak, I built a skateboard with 2x4s and 4 wheels pilfered from a grocery cart. My goal was to ride with the neighborhood boys on the half-pipe ramp. You can imagine how successful that was. If I had asked why I wanted to build a skateboard, well, it was my desire to be in the company of others, particularly these neighborhood kids. I could have probably come up with other solutions that would have addressed this concern in ways that were not threatening to my life, like that 2x4 skateboard that I designed and then rode. So I share these stories from my childhood to show you that my lifelong love of technology has often blinded me from addressing the core issue and asking why. So let me bring you back into Design for America. Recently working with a Chicago-based healthcare center that serves underserved patients in Chicago, the team at the healthcare center was interested in increasing access to digital health records by designing a new app. So this is probably something that you're a familiar challenge. So when the team asked why did they want to design a new app, they learned that the health clinic wanted to do so for 2 reasons. The first reason was patient-centered. They wanted patients to be able to access test results and records anywhere at any time to improve the health outcomes. And the second was financially motivated. With greater adoption of healthcare records, the healthcare clinic could receive more funding from the state. So when the team asked patients, the Design for America team asked patients why they weren't accessing the records, the answer was many of them at this time, this was about 5 years ago, didn't have smartphones. And they explained that accessing these records require them to go to the public library and reserve time on the public computer to access the internet. And when they asked the doctors why they were not fully accessing the records, the doctors again explained just lack of time. Too many patients, too little time. So in short, this was a great lesson in understanding that the original ask, which was an app, was actually not the appropriate solution for the patients who did not have ready access to smart technology. And the team ultimately developed other clinic-based solutions, many of which were non-technical, to support adoption. So a second reason we might ask why, beyond getting to the root cause, is to really what it does is it forces us to talk with real people. Talking with real people, I have found, leads to trusted and committed relationships. And trust and commitment is absolutely critical for tackling the difficult challenges that often require years and years of painful trial and error. So consider another Design for America team that I described earlier who wanted to reduce the hospital-acquired infections. It took the team 5 years from the initial meeting with the hospital to measurable impact of reducing hospital-acquired infections through hand hygiene. If it hadn't been for their original investment in the relationships formed by asking the question why, I'm not sure if they would have persisted. So going back when they were 19, within the first week of the project, the team came back and reported that with interviews with doctors and nurses, all agreed unanimously on the importance of hand hygiene. It was clear to them, it was absolutely clear that they should do it. It wasn't clear to them why they weren't doing it. So I encouraged the team to spend more time at the hospital. So on one Friday afternoon after classes, the team went over to the hospital and spent the overnight shift at the hospital. And during this time, not only did they get to observe doctors and nurses in action with the patients, but they also observed that these were very well-intended staff who were simply forgetting to wash their hands at the appropriate moment. And so they learned more deeply that they wanted to, but they were forgetting. And also at this time, through the ritual 2 a.m. pizza and joke telling, which happens, I understand now, they developed friendships with these doctors and nurses and a real relationship. And so the team then went home after the weekend and developed a series of personal hand hygiene devices. These were things that fit on the doctors and nurses so they could wash their hands right on site. And they went back to the hospital staff and they showed them the mock-ups of these ideas. And the staff and nurses, I say, respectfully laughed. They said, no way would we ever use those. There's no way we'd ever do that. So the team was discouraged by their first failed attempt, but because of the relationship and the promise they had made to the nurses and doctors about their intention to help them with this challenge, they promised to return with more ideas. So then they began working much more directly with the staff, coming back on a regular basis and developing new ideas. So it took the team 5 years with many lows and some highs. And I'm convinced that had they not worked closely with the stakeholders most closely affected, I'm not sure if they would have persevered. I came across a great Nietzsche quote the other day that seemed to encapsulate this spirit, which was, he who has a why to live for, he or she who has a why to live for, can bear almost any how. So the third reason and final reason I'll discuss today about why we might ask why is that fundamentally it strengthens our curiosity. And by being curious, we can learn more about opportunities for impact. So curiosity is often described as motivating us to close the gap between what we know and what we don't know. So for example, to bring back my son, when working on a science report last week, my son learned and told me that a bat can eat up to half its weight in bugs in a single evening. I was impressed. But upon learning this, he realized he didn't know how big the biggest bat was and the smallest bat was. By asking why, he learned that the biggest bat has a wingspan of 6 feet and the smallest bat is the size of a bumblebee. So don't let it said you didn't learn about bats at Code for America. So consider the Design for America team led by Hannah and Aaron. They were interested in helping kids diagnosed with diabetes. Like the other Design for America teams, they were asking the kids, why was this happening? They spent time in their homes. They spent time in school classrooms learning. And what they learned is that kids often don't feel empowered to take care of themselves. And so in response, they created something called Jerry the Bear, and they actually crafted their schoolwork around this so that they could learn the necessary robotics and programming to build this interactive teddy bear that effectively allows kids with type 1 diabetes to learn how to take care of themselves by taking care of Jerry. And for those of a certain age in the room, I like to describe this as the Tamagotchi of the 90s with diabetes. So in doing work and asking why these kids were at risk, they also learned about other life-threatening illnesses in which kids felt unempowered and yet regularly faced. And so now they're working on a project, a special duck, which is very sweet, which brings comfort to kids going through cancer treatment. And what it does is, through interactivity, it brings kids a much-needed sense of control in a case when they often don't feel in control. So their work by asking why has spurred a whole new genre of patient-supported approaches to improving health outcomes, particularly for kids. So I'll conclude by reminding you, I've presented 3 reasons for asking why. The first one is get to the root cause. The second one is gain commitment needed to overcome the inevitable challenges faced when taking on complex challenges. And the third one is to gain insight for new opportunities. And so now for the skeptics in the room, I'll address two critiques that you may be having right now. Can asking why too much lead to what we call analysis paralysis, or the state when an individual overthinks a situation and becomes paralyzed in making a decision? So at Design for America, we think a lot about analysis paralysis, and we overcome it by not just asking why, but simultaneously also building prototypes. So recall the team who was at the hospital and returned home to bring new prototypes back into the hospital and simultaneously ask why again. In another case, a recent case with Design for America team was working with the YMCA. The YMCA asked Design for America for help recruiting college kids to be lifeguards. When Design for America asked why they needed to do this, the team learned that learning how to swim is a critical life skill and often takes practice. And with the upcoming shortage of lifeguards at the Y was starting to close down local swimming pools. So at the same time as asking why, the team started to build prototypes to learn more about the challenge. So to understand why the YMCA was recruiting as they were, they showed the YMCA a recruitment poster of Uncle Sam saying, "We want you." Perhaps you're familiar with this, often used to recruit people into the military. And by presenting the prototype that they made not seriously, but just as a fun way of provoking, it actually made the Y ask, why are we so focused on recruiting college students who are increasingly not interested in this position? But why don't we start recruiting military veterans who are both motivated by a sense of service and most often trained in CPR and first aid? And so the Y right now is starting to pursue this effort. So at Design for America, we avoid the analysis paralysis by prototyping solutions in parallel to increase both the rate of learning as well as to start to understand possible solutions. So a second critique that I often receive and think about myself is, can we truly know everything? Can we ever get to the bottom of everything? And the truth is no. The rate at which the world is changing makes this impossible. And so we must scope our challenges and the span of questions and the area in which we ask why. So consider a team working with the city of Chicago to extend Chicago's 220 offices to all new immigrant families in the city. By working with the mayor's office, the team identified 300 different groups of stakeholders, 300. They classified their stakeholders as primary and secondary, as designers are apt to do. And the primary stakeholders were those who had both the power and or the interest in tackling the challenge. They didn't focus on the people with low power or low interest in tackling the challenge, but rather they were focused on the people who really were motivated to do something. Ultimately, the team ended up pursuing a solution that's focusing on neighborhoods with high populations of immigrant entrepreneurs who are most eager to work with city services to start new businesses and create a new life for themselves. So as my talk comes to a close, I hope you are convinced that starting your approach to tackling challenges with the question why, you're more likely to identify and solve important problems in your cities, schools, governments, communities, instead of the wrong problem. I guarantee you will be motivated to keep going when the going gets tough, and you will continuously realize new opportunities for impact. So my call to action for you today as you head out to lunch is ask why. Why? Thank you very much.
Thank you, Liz. You're welcome. Thank you, Liz, and thank you for joining us for this digital delivery set of remarks. We're on a break now for lunch, and we'll see you back here in about an hour at 1 o'clock Pacific time to kick off more great track content. Thank you.